Jadi good morning everyone, selamat pagi. Nama saya Dharmesh, tapi saya akan cuba bertutur dalam bahasa Melayu dan English, because slide saya semua dalam bahasa English. And today I'm going to talk about topics, and the two topics are infection control, managing the spread of germs, and SARS-CoV-2 disinfection, which is the COVID-19 virus or killing the spread. Jadi ada dua bahagian dalam presentation saya hari ini, dan tujuannya ialah untuk lihat apa cara-cara baru untuk infection control berkenaan dengan COVID-19 ni. Tapi apa yang saya akan what I will share today is what we have heard a lot from past experience with SARS and Ebola, right? And COVID-19 is something similar. And for the disinfection, bagaimana cara-cara untuk buat latihan dengan disinfection berkenaan dengan peralatan-perubatan atau medical devices. So di sini saya akan bercakap tentang reprocessing of medical devices, apa maksudnya decontamination, disinfection dan sterilisation. Dan saya tahu speaker lain akan juga present tentang cara-cara untuk buat low temperature sterilisation, itu bagus juga. Okay. So sebelum saya bermula, saya akan buat sedikit introduction tentang ECRI. So I'm from ECRI or ECRI, and so we are independent research-driven global organisation. Okay, jadi office saya kat Kuala Lumpur, Malaysia. Tapi head office kita di US. Jadi segala research dan development yang kita buat berkenaan dengan medical devices atau peralatan perubatan ni dilakukan di lab di office di US dan juga office kita di Kuala Lumpur. Okay, and semasa kita membuat evaluation ni, we have very strict conflict of interest. Jadi kita tak dapat sponsorship or funding from manufacturer, tapi sebaliknya buat research and development ni untuk memanfaatkan hospital, our various member hospitals that subscribe to our publication. Okay, jadi maklumat yang kita dapat, all the report findings that we have, we share with all our okay, and also we are certified by various organization internationally. Jadi recognition atau credibility ECRI juga dari beberapa organization or tempat lain di US. Maksudnya we have been designated as a PSO, Patient Safety Organization, by the Department of Health and Human Services in the US. We have also been designated as an evidence-based practice center atau EPC, Agency for Healthcare Quality. Jadi apa yang kita dapat, kita publish, semua ni based on evidence yang baru dari segala research atau kajian yang kita dah lakukan. Okay, so itu sebagai background or introduction to ECRI. And what I want to share today is two parts. So the first part is berkenaan dengan infection control. Memang kita nak lihat spesifik tentang medical device. Before we look at medical device, we also want to look at generally when we manage the spread of germs. Okay, germs from bacteria or virus or other pathogen. How we look at managing the spread? So we call it controlling the infection. So one of the first areas we should look at is sources. Where can this virus, bacteria live? So in the hospital, we have three main areas where we can find these germs, which is on surfaces, clinical surfaces. You see sometimes on the walls, on the tables, on the chairs, on objects that you find in the hospital. And of course, secondly, is on human skin. So all the people that are working in the hospital, as human beings, we also carry a lot of germs on ourselves. So this is another source of where the germs can inhabit or live, and of course transmit one place to another. Of course, thirdly, yang penting yang kita akan cakap tentang hari ini is on medical equipment. Okay, of course, medical equipment is more complex because you have all sorts of medical equipment. You have large imaging equipment, you have smaller equipment like patient monitoring. You also have what we call medical devices that are portable, handheld, used throughout, moving from one department to another. Okay, so all these are the sources of potential sources for infection. And when we talk about precaution, how to prevent for these germs to multiply or grow from these sources, we have provided some very basic method or recommendation. As you can see, cleaning the surfaces daily, disinfecting clean surfaces, and sterilizing medical equipment. And this is the three terms that I will talk a bit more later. Apa bezanya kita bercakap tentang cleaning, disinfection, and sterilization. Apa bezanya? And of course, depending on the application, depending on the area where you want to clean or equipment which you wish to decontaminate, it depends the method that you use. So use standard precautions, and this precaution may be given by the hospital, may be provided by the manufacturer on how do we sterilize or clean medical equipment. Okay, so moving on, we also look at how often do you clean and disinfect. Everything that you do, you have to record the frequency and of course where you perform the activity. You also look at manufacturer's instruction. Okay, so if I go part by part, you can see that these are the standard precautions we take, all right, when cleaning or disinfecting medical devices. Okay, so once we know the source of where the germs live, we also look at who else can host germs. Means these virus, bacteria that are found, it can also move or transmit from one location to another through these people. So patients themselves, which can be carriers of these potential infections, healthcare workers such as doctors, nurses, engineers and technicians, and whoever else is working in the hospitals, and even visitors. And so you can see that during this COVID-19 pandemic, where hospitals, they severely restricted the number of visitors. That means even family members or friends who are visiting patients can be potential carriers, not only bringing in the pathogens, but also bringing out of the hospital potential deadly infections as well. So we look at that. And for precaution, when we're managing this kind of people, okay, whether it being patients, workers, or visitors, what we normally say is follow the precautions of isolating the infectious patients in exam rooms. So what has happened is for COVID-19 patients, normally if they are suspected or even high chance of having COVID-19, they are placed in special rooms, in exam rooms, and isolated from the rest of the other patients. And if some hospitals have this special negative pressure rooms, where you can even isolate further the transmission of these deadly pathogens, they are placed usually in these areas. And also you have to have a policy, okay, if this infectious patients or people, you have to ensure that there are areas where you don't touch any touch points in the room or in the department. For example, like waste receptacles where you throw your PPEs or you throw waste. All that should be no touch. It should be easily operated by the feet. If you press the receptacle, it will open and you can throw your waste inside. The third point also is appropriate vaccinations. So we know that for some diseases like hepatitis, you have vaccinations, but even for flu, influenza, the general flu, you have vaccinations. But this kind of newer infectious diseases like SARS or even COVID-19, we do not have vaccination available. So it's difficult to uh, administer this kind of precaution. But generally, for other infectious diseases, one of the controls is to ensure that all your staff, even your frontliners or even your uh, anybody working within the hospital environment, you have uh, all properly vaccinated. The next point is on access to hand washing. All right, so you should have enough sinks with uh, proper hand washes or solutions for washing hands, or if there is no sink facilities available, you can provide alcohol-based hand sanitizers. So again, this is to do with hand hygiene, okay? Because of course, moving from one location to another, touching one patient to the next, touching objects, doors, medical equipment, all can transmit this kind of bacteria or viruses. So having this kind of control for hand hygiene is important. And of course, visual aids. This is on providing enough information to everyone there on what are the universal precautions for infection controls. So on how you wash your hands, the method to wash your hands correctly. If you have to cough, how do you cough? Wearing the proper PPEs, for example, face mask if you're not feeling well or if you are coughing or sneezing. So all this should be all visual aids or posters should be adequately placed in various parts of the hospital. So this is part of the education that you need to give. And then looking at the different modes of transmission. So you have now COVID-19, able to travel through droplets at close range. Previously, people thought that this virus was airborne, but there were many theories or many people mentioning possible modes of transmission. But looking at generally germs, basic bacteria and viruses, how they travel through contact with humans, contact with surfaces, through inhalation or ingestion, meaning that it can move from one person to another. If you touch with your hands a place or a location which is contaminated, and then you instead touch at another location, and you can also spread that uh, germ. And inhalation, meaning that if you are in close contact with another person who is infected and you inhale that, uh, the vapors which carries this potential pathogens, you can also probably get infected. And ingestion is when you eat with, if your hands are not clean and you eat something and you ingest, that means you consumed it, it goes into your digestive system. Okay, these potential bacteria or viruses can also, infect others. So these are the different modes of transmission that we see. And of course, we're talking about COVID-19 now, it's no different. So that's why we have a lot of precautions that have been taken. And some of the standard precautions would be to ensure that whatever contaminated waste or materials, if you use certain devices, disposable devices on a patient, after using it should be disposed into a biohazard bag or sharp container. You should also, again, continue observing proper hand hygiene, that means proper hand wash. And sometimes you may need to retrain people on how to wash hands correctly and for the right period of time. Using PPEs, that means personal protective equipment. So make sure it is available and easily accessible. So now we use all sort of PPEs, the basic ones being the face masks that we have. We also have face shields, gloves, gowns, and various other protective equipment to ensure that you don't get exposed to this sort of germs. Also, you are not one of the ways that these germs can transmit from one location to another. And offering masks to patients and guests, of course, to limit the transmission range of these viruses. And finally, is to provide proper air ventilation and filtration systems. So if you look for the hospital perspective, normally these patients are housed in a location where there is negative pressure. And of course, this is to prevent that pathogen from moving from the room to the adjacent room. So it's all ventilated through the ventilation system. And sometimes you also have mobile filtration system. If you've heard of HEPA filters which are placed in a room to continuously clean the air. Okay, so understanding this infection control practices is important. Okay, especially when you are working in an environment where you have all these potential hazards of infection. Having proper hand hygiene, using the right personal protective equipment, keeping up to date with your immunization, safe handling and cleaning of all medical equipment and surfaces in the patient environment are all important practices that you need to have. Okay, so I'm just going to pause for a second and see the next slide here. So now moving on, we also look at what considerations that we should take during medical equipment maintenance. And we, or most of the people here, if you're handling medical equipment in hospitals, or you believe this equipment have been contaminated by certain infectious viruses or bacteria, and you want to take certain precautions, what should you do? Okay, so I think these are the three things that you should look at. First is the perspective of reprocessing medical devices. So, of course, single-use medical devices, you use once and you discard, you throw. But reusable devices, all right, you will need to undergo certain steps if you are planning for decontamination, disinfection, or sterilization. Okay, so these are three different types of reprocessing that you could apply for medical devices, and it could apply to any of the medical equipment. But generally, when you talk about decontamination, is the first step. Okay, if let's say you feel a medical equipment has been exposed to some contaminants which are potentially infectious, and of course, using the universal precaution, we should consider that before operating or opening up the piece of medical equipment for your maintenance, you should decontaminate. And decontaminate is usually using basic cleaning steps to ensure that there's no visible blood or tissue or fluid that is on the medical device. So you may use a cloth with warm water to remove this, or you may even use brushes to remove some contaminants on the medical devices. But of course, when doing this, you need to use the right cleaning agent, okay, to perform the cleaning, and of course, use the correct PPE. For example, when you're using your gloves, and of course, face shields. So, whenever you perform the cleaning, there is no splatter on the person. So that's on decontamination. But when you talk about disinfection, so disinfection is a bit of a higher level step that after cleaning and rinsing perhaps the medical device, you may want to use a solution, a disinfectant solution. For example, it could be glutaraldehyde, it could be isopropyl alcohol, or use any ammonium compounds, all the right solutions in the correct concentrations. And you apply this cleaning to the medical device. So the purpose is to try to remove as much as possible bacteria or viruses which may reside on the surface of that medical devices. So the effectiveness again depends on effectiveness of the disinfection, on how much of contaminants you can remove. It depends on the type of solution and how strong the solution is and how you perform this disinfection step. And of course, the third step is to perform sterilization. Okay, and sterilization, there are a few methods. Okay, normally we all hear about steam sterilization, and steam sterilization uses high heat to sterilize certain medical devices. But some medical devices cannot be sterilized using heat, right? So there are alternatives, and I think the another speaker will talk about this later about heat sensitive medical devices. You may use alternative low temperature sterilization, for example using plasma sterilization, right, to kill as much bacteria or viruses which may reside on the piece of medical device. So the choice of reprocessing medical device depends on a few factors, okay, and sterilization is ultimately preferred, especially for devices which are used between one patient to another. But there are some medical equipment, of course, which you can't put in the steam sterilizer, uh, for your infusion pumps and your patient monitors and your beds. So, of course, we will be utilizing various methods of performing disinfection with the proper solutions. Okay, and then of course the thing about medical equipment maintenance, the people who are performing that, which are the engineers and the technicians, uh, you have the risk of infection that you have to be aware of. Okay, so far from ACRIS reports that we have seen, we are not aware of any cases on infection that is associated with handling of equipment or from this COVID-19 patient. So far we have not seen that is a source of uh, infection. But the highest risk of infection would be if your engineer or technician had to enter the room with the COVID-19 patient and perform some sort of repair or maintenance on the medical equipment, or need to perform some sort of task on that device. So that we believe is the highest risk of infection. So if you do not have to enter the room, if you just have to handle a device has been used on a COVID-19 patient, I think that the chances are minimal infection concern, because after you decontaminate or after you clean it, should be minimal infection concern. But also a minimal infection concern would be devices, medical equipment, which maybe have a cooling fan inside the device, and it has been used in a room where there was a COVID-19 patient. So there is, of course, a worry that the air which has been drawn into the equipment may also have this sort of potential contaminants. But again, it is a minimal infection concern, because once it is clean, and of course the filters that are used within the devices should be able to remove this sort of potential concerns. The higher infection concern that we see when it comes to medical equipment is the risk of infection from handling devices which have been directly applied on the patient. So for example, in a ventilator, you have your breathing circuit which is used. So there may be some patient's secretion or body fluid that has been left behind in this breathing circuit. So that is a concern if you come into contact with that, or even other devices where there is maybe urine or feces or other patient excretions which may be found on those devices. So that is also could be a concern. Other areas of concern is the HEPA filtration systems, okay, where you have portable HEPA filters that are used, and all those, when you clean or maintain that piece of equipment, you need to be more concerned or cautious. And of course, handheld items, so anything that a patient has touched, for example, the side of a bed or nurse call buttons or some remote controls, and even non-medical equipment such as pillows or the television remote and things like that could also carry all these contaminants. So all that have to be properly disinfected. Okay, and as I said earlier, the highest infection concern is when you have to enter a room with the COVID-19 patient. So just ensure that appropriate PPE is used, especially when in close proximity, okay, with the patient, especially when there are potential exposures to droplets from the patient sneezing or the patient coughing. This is all potential exposures. What we call it as also aerosol generating procedures. So some procedures that you perform on patients where it could aerosolize the contaminants into the air, that is concerned. So some of the protective steps, what you could take is, of course, number one is do not enter the room with the COVID-19 patient unless you have to. And if you have to, the second step is use PPEs, the correct protective equipment, especially if you have to access an equipment which is inside the patient room. Okay, and of course, observe proper hand hygiene. So when you are handling these devices, before and after, make sure you disinfect your hands before moving on to other work. Okay. Other steps that you need to take, protective steps, is when you are moving equipment in and out of the room where the patient is housed, especially the COVID-19 patient, make sure that this equipment is decontaminated before moving from one location to another. Okay, so back to the second part of the presentation here. Here, what ECRI has done, we have provided some guidance on what steps you should take when you are looking at not only the medical equipment, but also when you're looking at other devices which are found within the patient room. And usually we look at, if you have a day shift and a night shift, that this disinfection or cleaning should be done at least twice a day. Okay, and if you are looking at some of the areas where are normally the potential areas where there is high touch or high touch points, the cleaning and disinfection should also start with the bed rails, the tray tables, the devices like telephones that are used by the patient, before you actually also look at medical equipment. And we look at medical devices, things like your ventilator control panel, okay, where your infusion pump control, all those areas should also be properly cleaned and disinfected. So here we just provide a checklist of what you should look at when you're cleaning. So of course, all this can't reach the sterilization level, so you would use proper solutions to perform disinfection, okay, once a day and once in the night, depending on the shift. And then if I go further here, you can see that many other places in the room which you will need to disinfect. Okay, we're talking from the sink basin to the bathroom to the grab bars. So very specific areas where all potential touch points by the patient or by the caregivers. So all this have to be properly cleaned and disinfected. Right, so when we are looking at COVID-19 specifically, these are some of the recommendations from ECRI on what you should be doing. And of course, looking at patients, residents, and staff, you cohort them. That means you know which group of patients, which group of residents, which group of staff are attending or assigned to which location. Okay, and are they using the proper PPEs? Okay, are they trained to perform certain procedures on these infectious diseases, infectious patients, and are they taking the right steps? Also, identify rooms where you are performing these procedures. So in the hospital, you may place the COVID-19 patient maybe in the emergency area, or the COVID-19 patient may need to be housed in the ICU. All right, and when they're in the ICU, they may be placed in a negative pressure room, which is good. But still, the people going in there, you may not have adequate rooms, so you may modify normal pressure rooms to be used. And when you perform certain aerosol generating procedures, you need to take the right precaution to ensure that it doesn't the movement of air, it doesn't move from one place to another and infect another adjacent rooms. Okay. And also looking at the disinfectants used. All right, so the disinfectant solutions that we use for SARS-CoV-2 virus or the COVID-19 is basically, I think, has been many of them approved by WHO. The WHO has provided a lot of guidance on what sort of disinfectants that should be used, what sort of solutions which are effective and not effective. But when you're using disinfectants, make sure that most of the disinfectants are to be used for wiping or physical disinfections, where you need to put it on a cloth and wipe down the locations or the devices. Some disinfectants may be recommended for spraying, but you should know the difference, right? So not all disinfectants are to be used for spraying. Some, for example, if you're using sanitizers, they are not meant to be used as disinfectants, okay, because they may not have the right mix of solutions to be used as disinfectants for devices or for spraying. So make sure you use the right disinfectants. Ensure the staff are trained. That means staff who are performing the disinfection of the rooms or disinfection of the devices, they are trained on how to use it correctly, use the right disinfectants and a method of application or wiping down those devices they should be aware of. Use checklists. That's what I showed you earlier. You can use a checklist to ensure that you have covered all the different areas to be disinfected within the room or the location, and use adjunct disinfection technologies if available. So other disinfection technologies which are around, you may have heard of, is some people use a UV light. So they claim that a UVC light can be used to disinfect certain surfaces. So that is one potential. Others may say of using disinfection of masks. There's also talk about using certain hydrogen peroxide vapor for disinfecting masks. So these are the new applications available, but I do recommend that you visit ECRI's website to know more about what are the new disinfection technologies available, or those that have been approved by WHO or approved by other organizations that have tested these technologies versus what is generally promoted out there. So you need to know that whatever disinfection technologies you use are based on proper evidence of effectiveness.
Halo Pak Darmesi.
Yes.
Baik. Katanya mau ngasih video atau gimana? Apa terakhir ini?
Yang the video tu berkenaan dengan introduction to ECRI. Tadi saya tak letak tu, ada sound, problem dengan sound dia kan?
Oh ya udah nggak apa-apa, ini aja ya.
Jadi tak apa, saya dah beri introduction.
Okay. Thank you Pak Darmesi, sudah lanjut.
Okay, so yang ni this is the last part. So those that need more information berkenaan dengan new ways of disinfection or new ways of looking at the situation, what recommendation from ECRI, you can also visit our website. So this is one example berkenaan dengan UV light for use for disinfection. So ada yang some people state that it's effective or not effective. You can read our report. It's available free on our website. Okay, and with that, thank you very much. Terima kasih.